All right, so it is 1 o'clock on the hour, and we are going to get started. Good afternoon, everyone, and welcome. I am absolutely thrilled to have you with us today for what promises to be an energizing and deeply relevant conversation. The support triangle, how leadership, staffing, and workflow design sustain evening operations and staffing. I'm Tanya Davis, and I have the honor of serving as your moderator today. And for over 20 years, I've worked in hospitals and health systems across the country. And if there's one thing I've learned, it's this: great care doesn't stop at 5 p.m. Evening and weekend staff are the backbones of healthcare continuity, yet far too often, they are the most overextended and under-recognized members of our team. That's why we're here today. This discussion is, I should also note that this discussion is part of the national initiative sponsored by HRSA to improve the way we deliver care outside of traditional hours, and more importantly, to strengthen the systems that support the people who are delivering the care. So I'd like to start by introducing our panel experts. So we brought together a group of panel experts, each of whom brings a unique lens to this conversation. So we have Von Barker, who is a master of workflow redesign and operation excellence. He has several decades of experience in healthcare operations. He's CEO and founder of Barker and Barker Enterprise, and he's passionate about excellence, and he has a relentless drive for improvement, and throughput. Sorry. Next, we have Christine Callahan, who's a nationally recognized leader in healthcare staffing. Thank you, Christine. We're happy that Christine was able to join us, and we received a lot of questions around staffing. Christine also has many, many years in the healthcare sector as not just a healthcare staffing, but process improvement, operations management, and leadership. And then we have Francesca Viola Hamilton, who comes with a background in mental health and team building expert. And she comes to share with us what leadership looks like when we're looking at evening and weekend hours. So together, this panel will share actionable items and strategies for you that you can take back to your various health centers and hopefully implement many of these strategies immediately to help improve your workflow, also elevate the culture of your staff, in addition to new creative ways into plugging those holes, those gaps with your staffing models. So before we dive in, just a quick note, we encourage you to submit your questions in the chat. So throughout this session, we have Natal Dixon Weathersby, who is here. She's our facilitator. Natal will be recording your questions, and we're going to make sure your questions get to the panelists so that we can address every question that we have. So let's start right now. We have a list of questions we're going to start with asking our panelists, and we're going to start with the leadership component. So looking at leadership, and this question is directed to Francesca, how does leadership visibility differ between day and evening shifts? And what specific approaches can bridge this gap?
That's a really good question, right? Because when we think about leadership and we think about what our employees see, we're thinking at different levels, right? And so there are our critical leadership, maybe our managers, our vice presidents, all of that. And then there's the leadership that sort of comprises the middle ground, right? And these are the people who do work shifts and are responsible for the day-to-day operations at the site. So one of the ways that in my own experiences, have bridged this gap is really making sure the set communication system be really into our presence at the site. And what I mean by that is that if we are not physically through conference calls, other times it might be through, know, shifting our own hours to meet the needs of employees and to be able to communicate one-on-one with them. For example, I worked previously in a 24-hour residential facility, and there were going to be times where who was a discussion about being present during those for them, right? And so that does require a certain level of sacrifice zone in terms of your own work-life balance. But having effective open lines of communication does actually help alleviate some of that. If your staff know that they can reach out to you and that they can get a response within a timely manner, it does make live stream.
Thank you, Frank.
So I guess the next question we have is, what communication structure are... Oh, I'm sorry. I'm sorry.
No, Francesca, Frank, go ahead. That's fine. We can.
Do you want me to continue with the next?
Yes.
Okay. What communication structures are most effective when direct leadership presence isn't possible during the evening hours, right? So in most systems, we rely heavily on electronic communication, emails, messages, notices, sometimes even looking at, memos as sort of traditional forms of communication. Sometimes stepping outside of the box and thinking about that also means, can we incorporate ways where our employees feel, again, that ability to reach out and ask questions when needed? So one thing that I think has worked for a lot of agencies in the past is, how do we communicate needed information shift to shift? So does that mean that we implement a shift change conference call? So as people are leaving their shifts and handing things over, and who is present in the space that would communicate directly, who needs to be on this phone call to be updated on things that are going on at the site, right? Has there been an emergency situation that has bled from the day hours into the evening hours? Who is managing that? Who is being kept in the loop around that? Who is actually responsible for them following up during the next shift? And then are there things then that need to be documented where there is a responsibility on team leaders and shift leaders to read those things, communicate those things, and report back to their superiors about how that line of communication has worked. Other times it might be something as simple as, blast messages. It's not always the most effective way of communication, but a lot of people rely on text messages nowadays. So is that something that can be implemented effectively among your team members? Is it something that is cost effective overall for the site? Is that something that would be welcomed by your team members, and also talking with them about what forms of communication might be most helpful for them as well, right? Where are the areas where your team might come up with some ideas about what would make things more easier for them to get information from? Okay,
Thank you. Thank
so
you,
the
Fran.
next question is, oh, sorry.
Thank you, Fran, for that. And I see we have a couple of comments in the chat regarding connectivity. So Nakel is checking into that to see. It appears to be a little choppy. So we're hoping we can get a clear connection for the remainder of the session. So we're going to move on to operational efficiency. So this question is directed to Vaughn Barker. What work elements should organizations first examine when they're going to optimize evening coverage and weekends, evening and weekend coverage? What workflow elements should the organizations first examine if they're looking at optimizing evening and weekend?
Okay. They should begin with value stream mapping. This way they can visualize the patient flow and they can identify any non-value added activities that may be happening inside it. Whenever they are actually developing their value stream map, one thing we tell people to pay attention to is, of course, the beginning and ending of the process, but the team needs to agree on exactly what is the process, what are the steps that are involved in the process, what are the terms, a syncing of the terms, and it's important to come to an agreement because what we found is there's a potential for three processes. There's the documented process, there's the process that management perceives happens, and then there's a process that actually happens. So whenever they are looking at elements and how to actually begin, one of the first or one of the most critical items in the beginning is making sure that you actually sync up these items such that as the project or as the project is going or the implementation is going, everyone has a clear understanding or the same understanding of what's going on. And to that point, as far as the terms, one thing that we do is create operational definitions in which we say, when we use this word, this is what it actually means. And as the project goes on or as the implementation goes on, it's good for them to actually keep a running tally of these. One, so as they go back and look at how this started and how did they get to where they're at, they have the list. But then also, if you want to expand the effort to other parts of the organization, when you hand this over to them, they have a clear understanding of what it is that you meant by certain terms.
Great, thank you. Share a little bit on, you mentioned process mapping. So who should be involved when you're looking at your evenings and weekend staff? And you mentioned for those who aren't familiar with process mapping, who should be involved in that process? And what does that look like?
Whenever you're doing process mapping, it definitely should not be just one person doing it. This should be a team activity, a workshop activity, in which you want to have input from different representatives from the process. This could be people from leadership, this could be people actually doing the work, and you can actually invite key stakeholders who may be recipients of the process or who may fund the process. But by having a group of people, you get various ideas and various information and various aspects about the process.
Thank you. Thank you for that. So we have a couple of questions for Christine. So for staffing solutions, Christine, what recruitment strategies specifically target candidates who might prefer or excel in evening positions?
Okay. Hello, everyone. I wanted to just start off. I am an RN, and one of the most important things before we get going in terms of talking about staffing solutions and strategies are to making sure that you understand the scope of practice of different clinical positions within your state. Sort of important just to kind of gauge and to get that to get sort of your arms around exactly what you need, particularly for off-hours staff where there might be less activity and more responsibility. So I'm going to tell you about 5 quick strategies that over 35 years of staffing for nurses and medical assistants, LVNs, and some of the ancillary positions in health centers. The first and foremost, and all of you have probably done some, if not all of these, but in case you haven't, I want to just kind of bullet them for you. First of all, is to tap into medical assistance and nursing programs in your area. Actually go to the medical assistant area, introduce yourself, let them know about your health center. It's a great try before you buy concept that you take on some students, particularly in the daytime. But then a lot of times those individuals like the health center, they're looking for a job and they will take a position in your health center, and you know their skill set and you vetted their skill set before hiring them. So that's the first thing. The second thing is to go in the other direction and look at retiree, like perhaps nurses who have worked in the clinical acute setting or other types of settings that perhaps they want a slower pace. They would want a couple of evenings a week just for extra supplemental income. A lot of times that is an untapped resource, which I think is a good strategy. The third strategy is internal float pools. Like if, for example, in your health center or you have affiliations with several health centers, you can do float pools whereby people put their names in if they're looking for extra hours. It's a nice way of kind of making sure you use internal staff for float pools. The fourth one is bilingual and community-focused recruitment strategies. So for example, a lot of working people, like a lot of people that are working during the day might actually, or their spouse or partner is working during the day and they need something in the evenings. How you craft your job posting is a significant strategy, right? So you want to really extol the virtues of evening and off hours advantages. So for example, lower patient volume, perhaps a little more autonomy in your position, meaningful work in a supportive environment, less chaos, but more kind of autonomy and being able to kind of run things the way that you want to run them. Sort of what Vaughn was saying, you know, mapping out the strategies of the patient flow off hours. So those are the 5 strategies that I think are very relevant, especially in this market. This market is very difficult to find staff for off hours positions.
Thank you, Christine, for sharing those 5 strategies. We have a question. Now we're going back to operations and flow. So we have a question for Vaughn in the chat. Could you explain why it is important to have staff stakeholder engagement? So the process is theirs versus someone else's.
Okay. It is very critical to have staff stakeholder engagement from the beginning. One thing you can do to actually get them engaged is communicate. One thing we do is create a communications plan in the beginning in which we look at the various stakeholders. We look at how much communication needs to happen to them with them as far as the frequency, what type of communication, and what method that we actually communicate with them. It's important that the various stakeholders are involved, especially staff stakeholders. So one, they understand that something is going on, a process is actually being changed or being created. But then also you want to make certain avenues that they actually are able to contribute. If they're not directly on the team, you can make avenues such they can indirectly contribute. And this way they start to have more buy-in. They feel like they have, you know, somewhat of a say inside the process. And also for, say, an external consultant company coming in or anyone else helping you who's not part of the core team, whenever they are no longer part of the project, you want the staff to feel and know that they own the process. And so one thing that we say is it is a project when we're involved, but it is always your process. And so we also always want to make sure that with the staff, they also understand who the process owner is, who will be in charge of the process afterwards. But all in all, it is critical to communicate with all the stakeholders, especially the staff.
Thank you, Vaughn. And so when we're looking at this approach, when you're taking this approach to map out the current process, to identify how things are working versus how we would like the operations to work, how do you incorporate, or how do you get the evening staff involved in that? Because we know most of organizational planning and meetings and those type of things tend to happen. Those we call our day shift centric, right? Those are happening during the day. But when we're looking at evening and weekend flow, what are some ways to get your evening team involved in that so that this process becomes focused on evening versus day shift?
Okay. The evening and weekend, or say off hours, or just say evening and weekend hour personnel are pivotal to these processes. They are the ones who actually
Did we lose his volume?
lived up or daytime work as they
Vaughn, we did for a second. We couldn't hear you for a second. So could you just go back and repeat quickly?
Okay. All right. Okay.
I'm sorry.
Okay. I was saying that the nighttime or the evening and weekend staff are very pivotal to the processes. And so we want to make sure we get their input because they live the process. They have a lower number of staff, so they actually experience different things that the daytime staff will not experience and that the daytime staff can't address because they don't experience it. So some ways to actually get their input could be by whoever's in charge of the project, and especially leaders, to spend some time in the evening or during the weekend actually talking to them to get input from them. Another way could be by surveys. Another way that we've done in the past is to have focus groups, even for second, third shift. At times, we would just say on a certain day or a certain night, we just have to be there, whether it's us or the management leadership of the organization. An additional benefit by having the managers or leadership of the organization going there is it shows that they care about the people, they care about what the people go through, and that they care to address those items and have their workflows to be optimized. So those are some of the ways that we've done it, or that I've seen.
Thank you, Vaughn. So we're going to move back. We're going to move over to staffing again. We have a lot of questions for staffing. So, Christine, we all know about differential pay, right, in healthcare. So if you're living in healthcare space, you know all about differential pay. But beyond differential pay, what innovative compensation or benefit structures have proven to be effective for evening retention?
Really good question. And sort of kind of one of the strategies / compensation, if you haven't done so already, one of the real advantages is it doesn't help with incumbent staff, but if you are hiring new staff, a lot of times I've seen situations that have worked really well where somebody has a flexible schedule. So for example, if you ask a medical assistant or an LPN, could you work one evening a week, 12:30 to close or 12:30 to 8? Many times, and 3 work days with one evening. The advantages of adding that sort of flexible schedule from the jump give somebody a sense where they can make appointments on a weekday morning and come in later and sort of perhaps have a less busy or whatever. So one of the strategies, and it sort of crosses over into a benefit, is sort of modifying your schedule and making the flexibility beyond compensation, the flexibility. Another strategy for compensation or beyond compensation is flexible work schedule. In other words, self-staffing. A lot of times in big health centers, you might see that the nursing or the medical assistant staff have sort of things out by months. And they say when they can work, when they can't work. If, let's pretend somebody has something with their a child during the day and they want to work an evening, doing a flexible schedule can be very advantageous for two reasons. One, it crosses over. You get cross education. The day people are working the night and the night are working the day. So you get better collaboration of your staffing. A couple of other things that are really helpful, and they sound sort of hokey, but recognition. I think that recognition for evening folks is extremely important, whether it's micro incentives like dinners or attendance awards or certain things that will basically pump up the evening staff to feel very important and to feel like they are an integral part of the whole health center. That, I think, is a critical element beyond anything to do with compensation. And then finally, like if there's an opportunity for childcare or caregiver incentives, many of the tax-free child care centers, have those types of things in their paychecks. However, if there's a stipend or if there is something that can be offered, I had during COVID and even after, because it was so successful, a local daycare company actually opened evenings, and they had this sort of very cool program, and it really helped the local hospitals and health centers to be able to tap into having their child go from 4 to 9 to daycare, and there were games and so forth, and it was awesome for both parties. So those are just a few of the items beyond actual compensation. Of course, everyone loves compensation, but those are some other strategies.
Thank you, Christine, for sharing those strategies. We're going to move over now to leadership. We're going to go back to Francesca. We have a question. So this question is around team building strategies. So what team building strategies have you found most effective for creating cohesion among your evening and weekend staff?
One of the things that we've implemented in the past have been trying to create spaces where staff are being celebrated and being invited to attend activities that occur at different times of the day. We also ensure that they are compensated for these times if it falls outside of their normal working hours. We had something in place where staff were encouraged to send shooting stars to each other as a way of recognizing, work or things that were something to be praised, right? The other also is, and much to what Christine was talking about in terms of like compensation and flexibility, is that being able to work with your staff around those things also helps with team building, right? When you bring staff together and you talk about challenges that they're all experiencing to get collectively, giving them a voice to be able to talk about ways that they can adapt things around that, right? Team meetings are really essential to team building because a lot of times things get communicated upward and then somehow it gets lost in translation. Being able to provide a safe space for staff to discuss challenges, needs, wants, and positive gains really establishes a closer relationship between them. And, also sort of thinking about, as you are structuring your shifts and when people are working, and that flexibility allows team members to, create connections with other people they may not normally see, and provides more support for them, in terms of just, being there and being present.
Thank you for answering that question, Francesca. So we have another staffing question. So Christine, so back to you. So looking at orientation and training, right? So what orientation and training differences are essential for successful onboarding to evening positions?
Oh, another really good question. So for those out there that use competency checklists, so when you're doing your onboarding, more than likely you've got different clinical competency checklists, orientation checklists. So one of the essential elements of that piece is to do the entire competency checklist, but have one dedicated to those people that work off hours, particularly because sometimes some of those items on the checklist would not be something that you necessarily would run into during the day. And let me give you a couple of examples. So if let's say you're at your health center, it's 6:30 at night, and you get a patient that comes in with difficulty breathing. Okay, so you now have what is a potential clinical emergency or an urgent situation that you've got to navigate with potentially not all the resources or not all the staffing or the equipment that perhaps is at the ready during the day. So there are certain elements of an off-shift competency checklist that, as a group, sort of what Vaughn was saying, is establish a group of people who could come up with what are the items that are challenges that we run into off hours. One of the ones are unplanned absences, right? The number one is if someone calls out. If you've got call outs, and I know all of you are probably shaking your heads, if you get a last minute call out, that poses a contingency plan, right? You have to then create, now what do? We've got to move this person, we've got to this, and we've got to work harder with less. So all of you have handled that. I'm absolutely sure of it. So trying to manage the unplanned absences, off hours, have a competency checklist of only those items that are, if lab or pharmacy or imaging are not open, or they just closed and it's 7 o'clock, or what relationships you have with your local emergency room or urgent care centers. In other words, to be able to pivot somebody over there if it's 10 minutes of 8 and you don't have the staff, the skills, or the equipment available to care for that patient. What do you need to do to get that patient from point A to point B? So those are the types of things that you would need to make sure you cover in the evening or in the off shift.
Thank you, Christine. Thank you for those insights into that. So when we're looking at successful operations during evening and weekend hours, so here's another operational question, Vaughn. Have you seen or have witnessed to be effective in supporting your evening staff while maintaining quality? So we know in a healthcare setting, you have your EHRs, of course, then you have all of your hospital-based or facility-based systems. But when you're looking at workflow and throughput, and when you're challenged with keeping things running smoothly, what type of processes or technology could be that you've seen that has been most effective?
One item is clinical decision support systems. Different type of, especially the more advanced systems that take real-time data or information, and as a person is going through a workflow, it actually sends information to them about what they can actually do, what's the next step with that patient or in their actual process. So the clinical decision support systems, we've seen that to be really good. Another thing is the closed loop social determinant of health, in which these are systems that if someone was to register, they're registering, and now how they have the questions in the beginning. If they say, "Oh, I don't have food," or "I don't have this or that," these type, when they're registering, we've seen some systems that will automatically reach out to agencies or organizations that can actually give them an appointment, like a nutritional appointment, and they can actually see the person same day, or in the case of the evening, they can actually see the person next day. So these type of systems, one, help the evening person with their workflow by feeding them information that in the daytime you have a lot of specialists, you have a higher density of specialists in the daytime. So these type of technologies actually offload some of the decisioning and keep the flow actually going. So we've seen those work well.
Great. Thank you for sharing that. So we're back now to staffing. So this is kind of more of a integration discussion. So we're looking across the board. We're looking at leadership, staffing, and workflows. So how should staffing models? So we talked a little bit about staffing, but how should our staffing models directly inform our workflow design for evenings or vice versa? So we're starting with workflow design or redesign, and then we're looking at how to properly staff. So how should our staffing models actually connect with the workflow design? How do we ensure that the models connect with workflow design?
Is that for me?
It could be for Christine or for Vaughn. So
Okay.
it's actually integrating both your
Oh,
staffing,
gotcha. Okay.
your staffing and your workflow. So we've gone through the workflow design process and we've identified what the workflow should look like. And now comes the challenge of staffing. So how do we make sure we mirror the two?
Well, from my perspective, from sort of a clinical perspective, and it's sort of in line with what Vaughn is saying, is you map, you get a sense in the evening. Let's say that your clinic is open 8 to 4, and there's a dinner break from 4 to 4:30, and then you start seeing patients for your for your evening at 4:30 to 8, 9, whatever. So what you'd have to do is map from 4 to 8 what that looks like, sort of what's being done procedure wise, how many patients per hour, who are your clinical people working, if you've got ancillary, if you've got advanced practice nurses, if you've got PAs, if you've got MDs, and looking at the ratio of staffing to provider, right? The provider to staffing ratio is very important to evaluate in the evening, because if, for example, I've had some providers that, because a lot of times you can see a lot of quick 6 at night from 4 to 8, a lot of people coming in after work and that kind of thing, what is euphemistically referred to as the quick sick. A lot of times you need more clinical support, more support staff to manage that provider, to keep them on target, to keep the flow going, sort of in Vaughn's. You design your patient flow and you come up with what you need to support that flow so that you meet the productivity that you need to meet for your evening staff, right? So if it's 4 patients an hour, if it's 3 patients an hour, whatever your demographic of your patients look like, you've got to look at what you're delivering, and then sort of what you need to support via clinical staffing, and what are they going to be asked to do. For example, if EKGs are done at night, if various lab urines testing, COVID, flu, all of that, if it's done in the evening, you've got to look at those staff to make sure that you've got qualified people on staff to do those at night. Now, it may be less volume, but that's from my clinical perspective, that's how I would frame up how to staff an evening clinic.
And and I will add to that, one way that staffing models inform the workflow is that we can actually look at cross-training the people. So instead of saying this person only do one job, or we may cross-train people to say here are the main items you do, but as it relates to telehealth, here are some additional items that you can actually help out with. So we may have a certain workflow for the daytime, but when we look at reduced staffing, cross training, and assessing and other processes come into play.
Thank you. Thanks for that, Sharon. So we're going to talk about work-life balance. We hear a lot about work-life balance, and most of the discussion or support systems tend to be during the day for day shift. So how are successful organizations addressing work-life balance concerns specific to evening and weekend staffs? Have you seen any particular models or strategies to help our health centers when we look at work-life balance for evening weekends?
Well, I certainly have some opinion on that. I was kind of waiting. But the three items that I would say are important would be for work-life balance is meet people where they live. And it sounds again a little bit hokey. And the most important thing, in my opinion, is when you are posting a job or you are starting to go to boards and put up what you're looking for. One of the key ingredients to that is sort of speaking to the advantages of the evening and the weekend shifting. In other words, kind of talk and tell the story about how advantageous it is to work in the evening. As I said, less noisy, less childcare expense, more flexible hours. There's just a lot of ways you can post the position to make it very attractive, particularly if a student is going to school during the day and wants something in the evening, or that's the kind of thing, is meet people where they live, as far as making it attractive for them to want to work in the off shift.
And so, Francesca, I see that you're nodding. So would you like to add to that? Do you have something you'd like to add?
No, just thinking about what Christine mentioned about how do you make these attractive, and then even in thinking about your internal systems and things that you implement with the staff with regards to their responsibilities, right? Having shift workers working all these different shifts, and it's like, well, we need you to be in compliance with these trainings. Are we offering these trainings at times that are convenient to them, right? Are we making efforts to ensure that when staff are working late evenings, weekends, that we are providing them access to these things at times that actually do work for them, right? And that's another incentivized option as well, because staff will more willingly consider these shifts if they know that all of the things that they need will be provided to them, because we are not viewing this as a day-centric opportunity with, we just have to have this evening coverage. Now it's like all these shifts now get the same opportunities and access to things.
Thank you. Thank you, Francesca. Vaughn, did you have an add to that? I saw you were unmiked. Didn't want to pass you by before we move on.
Okay, no problem. To that point, there are some people that actually, looking at the how do we make it more attractive? There are some people who actually, I'll tell you a personal situation. I was actually talking to someone at a health center who works in the evening, and he was sharing with me how he was happy to get that opportunity because he was always wondering when was he going to handle the things that happen inside the daytime. And so he was like, by working that Tuesday through Friday or Tuesday through Saturday evenings, he was like, he was able to have Mondays off, and that way he could handle that. But as it relates to workflow, to the point that the daytime and the nighttime are different, workflow wise, as it relates to work-life balance, one thing we could do is reduce some of the paperwork burden of the evening. And therefore, they're spending most of their time directly with the patient doing those items, and any of the administrative items that don't have to be done in the evening, that's not an additional burden for them.
Great, thank you. This is all great strategies and options to think about. Going to move into career advancement. So when we think about career advancement and creating career advancement ladders and within our health system and our health centers, how can organizations or how can our healthcare facilities create genuine career advancement opportunities for evening and weekend staff? So this is probably a question for Christine. So when you're thinking about career advancement, which is another opportunity to incentivize, right, our employees to stay. So we talk about retention, right? Not just the recruiting piece, but going from recruitment to retention. You want people to see your organization as a place where there would be a long-term working relationship, and career advancement is important. So what have you seen around career advancement programs for evening staff?
I've seen a couple of different things depending on sort of what the clinical role is, but here's a couple of interesting stories. So if you have an MA that starts, let's say, because of maybe their lack of knowledge, or they're just out of school and they're working days, if you want to make them feel that they have a path, one of the things that I've done in my past is create a where somebody might, in order to become, let's say, the next step from a medical assistant would be senior medical assistant. Well, a senior medical assistant has sort of a little bit of supervisory responsibility. So what I've done in my past is do some rotation of shifts where we talk to the medical assistants about going on tracks, right? So track 1 might be 6 months on days so that you learn the job. Then you might have a 3-month track 2, and track 2 might be evenings, where you then are a mentor to, or you might be working with learning the skills of a senior MA position, but in a less hectic or busy environment. Then you might have track 3, where the medical assistant then spins back to days and now can not only know all the things responsible for the senior MA, but that can then pollinate those to the day where it's much busier. So offering rotations, and the same goes with clinical supervisions. If you have a clinical supervisor, an LPN, same kind of thing. One, if you can't sort of, if your health center wouldn't support, or you don't think you could find people to do, 3 months worth of evenings, that's kind of a big ask. What you could do is do something where you have the supervisor work one of those late shifts that I was telling you about, like have the assistant nursing supervisor or the nursing supervisor work one evening, 12:30 to close, at your health center, which will enable him or her to be able to see sort of what some of the management opportunities are off hours, right? So they would be able to look and see, and likewise, the evening staff then feel supported, right? They feel like, oh gosh, that clinical supervisor is working nights so that she feels what we're dealing with, or our productivity, or whatever. And that helps to navigate change, right? That will help with staffing patterns, help defend if you are in a situation where you have to defend the need for additional FTEs of staff off hours. What are those people doing? How can they be justified working evenings? And those types of career trajectories, I think, are really important at gaining people to stay within your health center and not be hopping for the next hourly increase kind of thing. If they see a path where they can go, if they so choose, and that there's that next step, I think that is very motivating to some work, to some clinical staff.
Thank you, Christine. Thank you for that. Fran, would you like to add anything to that? We're talking about building career paths for our evening and weekend positions.
I think also it's really looking at your staffing patterns and seeing where there might be opportunities to create sort of these in-between positions that, much to what Christine was talking about, might actually provide staff with stepping stones that would move them closer to higher level positions. We do realize that positions form a pyramid, right? And so the higher up on the food chain you go, the fewer positions exists, but creating opportunities for staff to take on extra responsibilities, but not necessarily being in higher level positions also creates this sense of, improvement. They're watching progress for themselves. They're meeting milestones. And this could also be something that is ingrained into any annual reviews, right? Setting goals for what would be tasks that would be worked on throughout the year for these staff in order to, get them moving closer and closer to where they would like to be.
Great. Thank you for all these great questions and all the valuable information that you've shared. We're about 5 minutes before close. So we want to also share upcoming events that we have after this one. But the very last question, I don't see any additional questions in the chat. Nakel, if there are any questions, please let me know. But I'm going to move to the one, and this is directed to each of our panelists. How are organizations, no, not that. Let me go to this one. What's the one action item? And people probably want to know this. What is the one action item you would recommend healthcare leaders to implement immediately to better support their evening and weekend staff? So what is that one action that you would recommend?
Okay, I'll go first. I would recommend the leaders shadow the evening shifts for a week or whatever time frame that they actually have the evening shifts. And that way they get firsthand knowledge and information of what happens. They actually show support for the people that's there. And then they can take their learnings and apply it however, whatever leadership role they're in. But going to Gemba, seeing the process, seeing what they actually face, I think that an immediate action that they could do is to spend a week or whatever time frame that they actually have it so they could see what happens.
Thank you, Yvonne.
I would, it's hard to kind of narrow down just one, but I think my top one would be to really hone in on exactly what you need, when you need it, and how you can get it. And I know that sounds very generic, but what you need is looking at the staffing you need for the evening. Well, how you're going to get it is sort of how do you frame up and recreate a posting or create a situation that will enable you to get what you need. And I think that creating a system where you really hone in on what it is you need and what it is you're looking for will almost give you the answer or help you support an evening clinic. If you are just starting to open evenings, or you're already open evenings and you're trying to figure out how to staff it, that would be the number one thing is ask yourself in a group of people, what do we need? How do we need it? And how do we get there? And I do think that would give you the very picture that you need for your particular health center.
Thank you, Christine. Francesca.
Very similar to what Vaughn said, is talk to your staff, get to know them, learn their names, figure out, what their challenges are. I love the idea of the shadowing. Get out from them, ask questions, because, you know, they are going to definitely have very different experiences than your day shift staff. And you want to definitely, you know, understand those challenges.
Thank you, Francesca. Now, I'm just checking any additional questions or one final question from the audience. So we have time for one more question. If you have a question for the panel, please drop that in the chat.
Nothing right now.
Okay. All right. So I hope everyone enjoyed the panel discussion today and that you're able to go away with at least one action item to explore, to consider, or to share with your team to improve your operations for in the evening and weekends. And so we also want to take a couple of minutes to share a few upcoming events, and we're going to allow Augustine to pull that slide up to join us in the month of June. I believe we have 2 events. So we'll have Vaughn Barker, who will be coming back in the month of June. And are we showing that slide? Do we see that? Augustine?
Yep, pulling it up now. Sorry about that.
Okay, yeah, I think we see it. It's just small. Yeah, so I'll turn it over. I'll let you share what's coming up.
Okay, give me 1 second. Okay. Can you all see my screen? I'm sorry.
Yeah, we see it. We see it
Okay,
a little bit.
making it full screen now. Sorry about that.
Okay.
Okay, we have some great things in store. Starting off with our motivational interviewing part 1 with our presenter, Francesca Viola Hamilton. That will take place on June 18th at 1 p.m. And we have a Zoom link that we will post in the chat for you guys to register. And then following that, we will have our workflow excellence presentation with our presenter, Vaughn Barker, on July 9th at 1 p.m. So looking forward to those events and hope that you all can join us.
Yeah, can we drop those links in
Sure
the
thing.
chat for
Absolutely.
registering motivational interview in part 1 and also for workflow excellence. So if you're interested in hearing more about workflow excellence, how you can improve the processes of your health center, also ensuring that you are right staffing, right? So we're looking at your processes and how much staff you need to support your processes. Come out and join us on July the 9th. Vaughn Barker will be leading that 1-hour session, and these sessions are CME accredited. So if you attend the entire hour, you will receive 1 hour of CME. If you're looking at outreach and patient education and connecting and engaging with your patients, you want to come out and hear Francesca, where she's going to introduce motivational interviewing part 1, and that is how to motivate and inspire your patients to compliance, because that's the whole goal here, getting our patients to comply with their screenings, with their follow-up care. Both of these panel experts will be back on July the 9th and June the 18th. I'm sorry, June 18th. Thank you for your time, for spending time with us this afternoon. We hope you found this valuable, and we look forward to you attending another event sponsored by HRSA as we focus on cancer screenings and workflow improvement in your health centers. Thank you and have a wonderful afternoon.